Jodhpur AIIMS related memory based question answer. Question number 1. False sensory perception not associated with real external stimuli is called option A concrete thinking, option B delusion, option C illusion, option D is hallucination. The correct answer is option D hallucination. Then question number 2. During blood transfusion, the most important nursing responsibility is draw a sample from the patient before each unit is transfused. Option B is warm the blood to body temperature to prevent chilling. Option C is running the blood at a slower rate during the first few minutes of the transfusion. Option D is maintain patency of the IV catheter with dextrose solution. Correct answer is option C. Run the blood at a slower rate during the first few minutes of the transfusion. Most important nursing responsibility during blood transfusion. Then question number 3. Kit supplied at subcenter is option A kit E, option B kit M, option C kit K, option D kit B. The correct answer is option D kit B. Then next question. A patient is emergency department has an endotracheal tube in place and is on the ventilator. His relative comes running to you telling you that the patient has pulled the tube out of his mouth. What would be your next step? Option A is apply face masks with higher flow oxygen. Option B, sit the patient up and consider chest physiotherapy to get the secretion out. Option C is reinsert the tube immediately under sedation. Option D, pull the tube out completely, bag and mask the patient and assess spontaneous breathing effort. The correct answer is option D. Because emergency department patient endotracheal tube is placed and patient is in ventilator. That is an total respiratory process maintain the ventilator. If patient pulled out the tube from his mouth, then respiratory rate is lower and the patient is continuous deteriorate. That reason pull the tube out completely, bag and mask the patient and assess spontaneous breathing effort. Then the next question. A phenomenon during therapeutic nurse-client relationship when the client unconsciously attributes or transfer to the nurse's feeling and behavioral predispositions from towards a person from his or her past is option A resistance, option B boundary violation, option C transference, option D counter transference. The correct answer is option C transference. Then the next question. Question number 6. A nurse in the labor room performing vaginal assessment on a pregnant client in labor and notes the presence of the umbilical cord protruding from uterus. What would be an initial nursing action? Option A gently push the cord into the vagina. Option B is place the client in Tendelberg position. Option C perform vaginal exam to note the presentation. Option D notify the staff that the client will be transported immediately to delivery room. Correct answer is option B place the client in Tendelberg position. Tendelberg position help to reduce the compress the umbilical cord. Umbilical cord compress হবে না, যার কারণে টেন্ডেলবার্গ পজিশনে রাখলে পেশেন্ট এবং বেবির মাদার এবং বেবি দুজনেই সেফটি সিকিউরিটি থাকতে পারবে এবং ডেলিভারিটা নর্মাল ডেলিভারি সম্ভব হবে। দেন দ্য নেক্সট কোশ্চেন. The term used to describe the discharge from the uterus during the puerperium and has alkaline reaction is option A vaginal discharge, option B is puerperal discharge, option C is amniotic secretion, option D is lochia. The correct answer is option D is lochia. Then the next question. Look at the picture and identify laryngeal marks airway. Option B oxygen marks, option C endotracheal tube, option D single lumen airway. The correct answer is laryngeal marks airway. You all are see the laryngeal marks airway and I am not here showing the any picture into this question, but all are check the laryngeal marks airway কেমন হয় সেটা আপনারা দেখে নেবেন। দেন নেক্সট কোশ্চেনে আমি আপনাদের সঙ্গে এটা শেয়ার করে দেবো। Then the next question number 9. The normal rate of cervical dilatation in the active phase of first stage of labor in a Primary catheter is option A 0.5 centimeter, option B is 2 centimeter per hour, option C 1 centimeter per hour, option D 1.5 centimeter per hour. The correct answer is 1 centimeter per hour. Primary catheter 1 centimeter হয় আর মাল্টি ক্যাভিটারদের ক্ষেত্রে 1.5 centimeter হয় per hour. Then question number 10, which of the following is not a mood stabilizing agent? Option A is fluoxetine, option B is lithium carbonate, option C valproic acid, option D clonazepam. The correct answer is fluoxetine. Then the next question, a client with schizophrenia has been started on medication therapy with clozapine. The nurse would assess the result of which laboratory study to monitor for adverse effect of his medication? Option A is liver function studies, option B blood glucose level, option C white blood cell count, option D platelet count. Correct answer is option C white blood cell count. Then next question, what should be added to normal saline which is connected to arterial line measure invasive blood pressure? Option A is potassium, option B is potamine, option C heparin, option D calcium. The correct answer is heparin. Heparin added into the normal saline and flush the arterial line. Then question number 13, please like, share and subscribe my channel for more information and সবাইকে এটা দেখতে সুযোগ করে দিন যাতে কিনা সবাই কোশ্চেনের অ্যান্সারগুলো করতে পারে এবং এক্সামে অ্যাটেন্ড করতে পারে। Question number 13, each community development block should have option A 1 community health center, option B is 4 community health center, option C is 3 community health center, option D 2 community health center. The correct answer is option A 1 community health center. Each community development block এ 1 community health center থাকছে। Question number 14, during a dressing change inspection of the wound reveals that appearing to be reddish pink tissue in the wound. The nurse interprets this as option A exudate, option B granulation tissue, option C a scar, option D sign of infection. The correct answer is option B granulation tissue. যখন দেখা যাচ্ছে উন্ডে রেডিশ পিঙ্ক কালার টিস্যু ডেভেলপ হচ্ছে উন্ড ড্রেসিংয়ের সময়, তখন যেটা মনে করা যায় যে গ্র্যানুলেশন টিস্যু ডেভেলপ হচ্ছে। দেন কোশ্চেন নম্বর 15, দ্য ডক্টর হ্যাজ অর্ডার 500 ml 5% dextrose to be administered for 5 hours. It should be administered during a burette set. The nurse has to set the drop per minute to deliver the appropriate amount. Calculate the flow rate. Option A is 100 microdrop per minute, option B is 80 microdrop per minute, option C 100 macrodrop per minute, option D is 80 macrodrop per minute. The correct answer is 100 microdrop per minute. পরে আমি আপনাদের এই কোশ্চেনের ক্যালকুলেশনটা দেখিয়ে দেবো। Then question number 16, all of the following for women with breech presentation at term seeking vaginal breech delivery is true except option is diagnosing breech presentation for the first time in labor in a contraindication to vaginal breech delivery. Option B is continuous electronic fetal heart rate monitoring should be offered to women with breech presentation in labor. Option C is vaginal breech delivery should be conducted in presence of a person skilled in the conduct of labor with breech presentation. Option D is vaginal breech delivery should take place in a hospital with facilities for emergency cesarean section. The correct answer is option C. Vaginal breech delivery should be conducted in presence of person skilled in the conduct of labor with breech presentation. Please like, share my channel for more information and সবাইকে দেখার সুযোগ করে দিন কোশ্চেন অ্যান্সারগুলো যাতে কিনা তারা নেক্সট এক্সামগুলোতে অ্যাপিয়ার হতে পারে এবং অ্যান্সারগুলো সঠিক করতে পারে। কোশ্চেন নম্বর 17, a nurse is monitoring manometer for CBP value from a central line inserted via the brachial vein. CBP line inserted in a patient in ICU on face mask with oxygen. For correct reading, she should record the value at option A. She should disconnect the manometer just before reading. Option B is either is correct. Option C is end expiration. Option D is end inspiration. The correct answer is option C is end expiration. Then question number 18, while assessing a patient cranial nerve, the nurse asks the patient to raise the eyebrows, smile and show the teeth to assess with cranial nerve. Option A is vagus, option B olfactory, option C facial, option D optic. The correct answer is facial nerve because when assessing the patient, asks the patient to raise eyebrows, smile and show the teeth to assess the facial nerve. Then question number 19, a woman using diaphragm for contraception should be instructed to leave it in place for at least how long after intercourse? Option A is 6 hours, option B 12 hours, option C 1 hour, option D 28 hours. The correct answer is option A is 6 hours. because a woman using diaphragm for contraception should be instructed to leave it place সেটা কিনা lower than after at least how long after intercourse মানে ইন্টারকোর্সের পরে কতক্ষণ ডায়াফ্রামটাকে রাখতে বলা হবে এটা একটা কন্ট্রাসেপটিভ মেথড আমরা জানি ডায়াফ্রাম কন্ট্রাসেপটিভ মেথড যেটা কিনা ওমেনরা ইউজ করে এটা কিনা কতক্ষণ রাখতে বলা হবে 6 hours। Then question number 20, look at the picture and identify procedure usually done in labor room. Option A NST, option B color Doppler, option C ECG, option D amniocentesis। আপনারা আমার আগের ভিডিওতে দেখতে পাবেন কিভাবে NST করা হয়, তাহলে সেখানে বুঝতে পারবেন। কারেক্ট অ্যান্সার ইজ অপশন এ NST। Then question number 21, order is 180 mg of cefotaxime intravenously, available form is 500 mg per ml. What is the amount of medication to be administered using a 2 ml syringe with 10 division per ml? Option A is 8 division, option B 18 division, option C 12 division, option D 1.8 division. Correct answer is option B 18 division. Then question number 22, a 40 years old unconscious patient is thought to the casualty following road traffic crash. His blood pressure was 80/60 mmHg. What will you do first? Option A protect airway, option B stat vasopressor, option C CT scan head, option D infuse 2 liter of crystalloid. The correct answer is protect airway, option A. Then question number 23, which of the following is considered for the fifth vital sign in emergency department? Option A is motor response, option B response to pain, option C verbal response, option D pupillary reaction to light. The correct answer is option D pupillary reaction to light. This is the fifth vital sign in emergency department. Then question number 24, a resident has given a top of epidural infusion 3 mg morphine with 10 ml of 0.1% ropivacaine. Which of the following symptoms require immediate action? Option A bladder ball incontinence, option B is confusion, option C is fast pounding pulse, option D is hallucination. The correct answer is option B confusion. Then question number 25, during what round you find that 24 years old patient with mania is very abusive and aggressive. There is imminent danger of his become physically assaultive. What you should not do? Option A avoid reassuring touching the patient, option B confront him, option C keep a safe distance from him, option D use of clear language. The correct answer is option B confront him, because patient is mania and patient is very abusive and aggressive. Then question number 26, a patient with diagnosis of urosepsis has been admitted to the ward. You have been asked to start noradrenaline for hypotension. What is the normal route of administration? Option A wide broad cannula in the posterior tibial vein, option B is peripheral cannula, option C wide broad cannula placed in the brachial vein, option D is central venous line in the subclavian vein. The correct answer is option B peripheral cannula তাকে করতে হবে। থ্যাংক ইউ গাইজ, প্লিজ লাইক শেয়ার অ্যান্ড সাবস্ক্রাইব মাই চ্যানেল। এবং যারা আমার কোশ্চেনগুলো অ্যাটেন্ড করতে পারছেন না বা দেখতে পাচ্ছেন তাদেরকে শেয়ার করুন, যাতে তারা কোশ্চেনগুলো অ্যাটেন্ড করতে পারে এবং দেখতে পারে এবং নেক্সট এক্সামে তারা যেন অ্যাপিয়ার হতে পারে। থ্যাংক ইউ অল।